Hello everyone, welcome to India's DNP ICU Hub YouTube channel. Today I am going to teach you how to interpret ABG in a very simple way. What happening, some new graduates are very confusion about that ABG. Is this ABG was respiratory acidosis or metabolic acidosis, respiratory alkalosis or metabolic alkalosis, which is the primary disorder? This is ABG was compensated or not? Is there any mixed disorder is present in this ABG? So much confusion about this in the ABG is there. So don't worry about that. In this video, I am simplify everything about in the 3 steps. Just follow the video, you will clear about that. I hope by end of this session, you are expert in this ABG interpretation. So stay with me till the end of this video. Let's get started. ABG, Arterial Blood Gas Analysis. ABG sample to be taken from arteries. And this ABG tells you about the 3 parameters in a patient's. One, first ventilation with the help of PCO2 level, and second one oxygenation status with the help of PO2 level, and third one acid base. And in this video I will be taking in the detail about the acid base. Now before jumping on into the interpretation of ABG or reading the ABG, we need to know the normal values of ABG. The first is pH having a normal range of 7.35 to 7.45, and it just tell you about the how your body maintaining the equilibrium of the acid base level. And second one, PCO2 level. The PCO2, which is partial pressure of carbon dioxide in arteries, the normal range is 35 to 45 mm of mercury. The third one, PaO2, that is the partial pressure of oxygen in the artery. The normal range 75 to 100. Some ABGs, some books are referred 875 to 110 mm of mercury also. So fourth one, bicarbonate, which is 24 plus or minus 2, you can say 22 to 26 milli equivalent per liter. So these are all normal values of the ABG in the normal range. Okay, the acid and base in our body maintaining in 2 systems. One is respiratory, which is called lungs. Okay, second one is renal, that is the kidney. Okay, now when you are getting the ABG in front of you, before reading the ABG, always try to have the brief clinical history of the patient, which might be give some clue about the primary pathology of the primary disorder. Okay, now coming to the important part of this session, those 3 essential steps interpreting of the ABG. Okay, the step 1, the first one is check the pH. Okay, if the pH is less than 7.35, then it is goes to acidosis. Okay, if the pH is more than 7.45, which is called as alkalosis, the patient going to alkalosis. There is a problem in the lung or kidneys, but we don't know which part, lungs or kidney, but we are finding out acidosis or alkalosis. Less than 7.35 acidosis, more than 7.45 alkalosis. Okay, now coming on the second step, finding out the primary pathology. Okay, right, the lungs control the carbon dioxide. Too much of carbon dioxide in our body, so patient will go into the acidosis, patient going to the acidosis. Okay, if the carbon dioxide level was less, which is calling as an alkalosis. Okay, the carbon dioxide, we are now talking about the patient carbon dioxide was high, normal range was 35 to 45. If the carbon dioxide PCO2 level was more than 45, that is acidosis. Okay, now that's carbon dioxide is less than 35, so that is going to the alkalosis side. Okay, next one, the kidney control the bicarbonate. Okay, if there's so much of that more carbon bicarb in our the body, which is called as the alkalosis. Okay, too much bicarb in our body, alkalosis. Okay, less amount of bicarb, that is acidosis. Okay, this is I hope this is clear for you. Okay, see the picture I am putting in the screen. Okay, if you have doubt, you can ask the comment section, comment part, I will explain it. Okay, don't worry, in this second step little hard for you. When we are going to do the examples practice, I will tell you, that time you will be already clear about that. Okay, now we are going to next step, coming to the next part, third step. This is about finding out that your body was trying to compensate or not. Okay,
now I am teaching to you how to in our body it's acting on the compensation mechanism. Okay, if now acid is increasing in our body, its base also increasing. This is a compensation mechanism. If the acid is increasing in our body, automatically the base also increasing. If acid also coming down in our body, base also coming down. This is a acid base compensation mechanism in our body.
This is the chart of compensation formula which we use right for different primary pathology. So first of all, you have to figure out the primary pathology and then whether the other system is able to compensate or not. I'll give the 5 example. You will learn everything and be ready to be a ABG expert. Okay, interpret the ABG from this clinical scenario, pause this video and read the history also and ABG provided, and see you will be able to come to conclude or not, then resume the video. Okay,
right. First example, 24 years old male presented to the emergency department. Today history of severe watery diarrhea and occasional vomiting. He complains of fatigue, dizziness and light headache. He not eaten or drank much over last 48 hours. Okay, this is his on examination, his vital signs. Okay, then his ABG, the pH showing 7.31 and PCO2 is showing 29 and bicarb is showing 15 and PO2 is showing 91, sodium 134, potassium 3.2 and chloride 108. Okay, as I told you, the first step, check the pH. Okay, normal pH water level 7.35 to 7.45. okay, this pH level how much? 7.31. okay, so which is indicating it's going to less than 7.35, so it is going to, this means acidosis level. In case it's going more than 7.5, alkalosis. okay, now this patient value is 7.31, which means the patient going to acidosis. We are check the acidosis level, we are find out the pH level to the help of, we are find the acidosis. Patient going on acidosis. Step number 2, we need to find the primary disorder, metabolic side or respiratory side. okay, which side the patient having a going to, we need to find out the primary disorder. After that we are find the acidosis. No, next coming to the acidosis part. okay, if that patient having acidosis, there is two things. okay, one, PCO2 want to climb, otherwise bicarb want to coming down. This is a formula. okay, always remember the acidosis means PO2 was PaCO2 was, carbon dioxide was climb more than 45 and bicarb was less than 22. But in this scenario you can see that patient having 29 mm Hg for carbon dioxide, which means not more than 45, so it's not climbing. This is not a correct, so we can put it. So next step, bicarb you can see less than, the formula was less than bicarb level, less than normal level, so it means less than normal level 22 to 24. So here what happening, patient value is 15, yes correct, less than normal value. This is a metabolic side the problem. We are find out the primary disorder were metabolic side. okay, always see the clinical history. okay, here anywhere mentioned anything about any respiratory side? No, so metabolic side only the most commonly going. So what is a acidosis? Here metabolic. okay, so the answer is metabolic acidosis. okay, this second step. okay, whenever you are seeing the metabolic acidosis, always remember next step you need to go the anion gap. You need to see the anion gap. The formula of anion gap, sodium plus potassium minus chloride plus bicarb. okay, this is a formula. Once you are applying the values of these values, the patient value, you will get the 14.2 the value. okay, normal anion gap value 10 to 16 milliequivalent per liter. okay, this is a normal anion gap value. okay, so here patient value is 14.2, so it is inside only, so this is a normal anion gap with the metabolic acidosis. okay, whenever you are seeing normal anion gap metabolic acidosis, you need to cause of NAGPA, normal anion gap. You see, this is normal anion gap metabolic acidosis. Just you remember this patient having what is the problem? Diarrhea. okay, next, if that high anion gap with metabolic acidosis means you need to see that methanol or uremia or ketoacidosis is very important disease condition. Lactic acidosis you need to monitor. okay, next step number 3, checking the compensation. okay, this what happening, bicarb was coming down and the bicarb was coming down and PCO2 also coming down. okay, now when you are seeing the primary disorder metabolic acidosis, you are find out. okay, next this is a formula, this is a winter formula. okay, I will show you. This is winter formula, 1.5 into bicarb plus 8 plus or minus 2. This is a formula. Once applying the patient's value, you will get the 28.5 to 32.5 mmHg the range. okay, this is expected carbon dioxide level in that ABG. okay, how much we are getting? 29. How much you are getting? 29. Expectation 28.5 to 32. okay, now inside only. okay, so it's compensating. okay, what happened whenever bicarb was coming down 15? okay, so PaCO2 also coming down. As I told you before, that as it was going up, base also going up. As it was coming down, base also coming down. This is a compensation mechanism. So what happening here? This is compensating. Which one compensating? PaCO2 was coming down. So appropriate respiratory compensation. Okay. Normal anion gap with metabolic acidosis with respiratory compensation. Okay. Now the answer is the partially compensated metabolic acidosis with respiratory compensation. Why I am here mentioning the partially compensated? You can see the pH value. Okay. pH how much is there? 7.35. This is a out of the normal pH value. Okay, whenever you are seeing the pH value, it's normal means fully compensated. If the dearranged means always you can tell that partially compensated. Okay, if in case 7.35 means you can fully compensated, you can mention, but here 7.31 still not compensated. So partially this is compensating, but you can tell the partially compensated. If in case here the same value, in case 7.35 means you can tell the partially, instead of partially you can tell fully compensated, but here 7.31. so partially compensated metabolic acidosis with respiratory compensation. Is it clear to you? Okay, this is second example. Okay, the patient had the dehydration sign and projectile vomiting. Okay, here that ABG is showing pH was 7.48, PCO2 47 and PO2 77 and bicarb was 32, base excess positive 7.6 and saturation 97.7. Okay, now we are going to interpret. The first step is, as I told, check the pH level. Okay, what is the pH level? 7.48. Okay, 7.48 was, what is the normal level? 7.35 to 7.45. Less than 7.35 acidosis, more than that alkalosis. What is the value here hitting? 7.48. So this is a alkalosis. Okay, 7.48 equal to alkalosis. Next is step number 2. After we are find out the alkalosis. Okay, now we need to identify the primary disorder. Okay, respiratory side or metabolic side. Okay, now alkalosis we are find out. Okay, alkalosis, what that formula? That one is PaCO2 was less or bicarb was climbing high. Okay, now the patient value, what PaCO2 level? 47. Okay, we are at 47. Then bicarb level was 32. Okay, now you see that value 35 to 45 is a normal value. Less than 35 means is okay, but here climbing, so this is not. Okay, next one, increasing the bicarb level. Here you see normal value 22 to 24, no, so here you see 32, so it's a correct. So alkalosis. So alkalosis metabolic side is a primary disorder we are found. Okay, metabolic alkalosis. Now you see the metabolic alkalosis formula. This is a winter formula. If you are applying in that, you can get the 37.4 to 47.4 mmHg expected PaCO2. Okay, we need to step 3. This is a step 3, compensation or not. Step 3. Okay, we are finding the compensation or not. Okay, now expectation was 37 to 47. Now actual patient PaCO2 how much? 47. So inside only. That's so appropriately respiratory was compensating. Okay, so the final answer is what? So final answer is a partially compensated metabolic alkalosis. Okay, partially. Why I am putting partially? Because you see the 7.48. It is 7.35 to 7.45 means it is fully compensated. Okay, but that out of range for the pH value is out for range. Okay, so partially compensated metabolic alkalosis with respiratory compensation. Respiratory was compensating with respiratory compensation. I hope everyone is clear. Next we are going to move on the third example. A 24 years old female presented to the emergency department with complaints of chest tightness and dizziness, tingling in her finger on SOB for 30 minutes. She is visibly very anxious and crying. She mentioned she has been under the significant stress due to the recent examination. Okay, she denied chest pain, fever and any past medical history. Okay, her ABG was it's showing the pH was 7.50, PaCO2 was 28 and bicarb was 22, base excess was -2 and PO2 was 95. First step, as I told you, check the pH level. Okay, check the pH. pH was how much? 7.50. It is increasing level. So which means increasing means alkalosis stage. Okay, next step was primary disorder. We need to find the primary disorder. Okay, the alkalosis means what I told, decreasing the PaCO2 or increasing the bicarb. Okay, now normal patient value was 28, bicarb value 22. Okay, the patient actual value now you see that PaCO2 was normal value how much? 35 to 45. It's coming down, so it is correct. Next value, increasing that bicarb level. So normal value 22 to 24. So what here doing? So 22. So it's not increasing. So it's not a normal level. So it is wrong. So which means respiratory acidosis. Patient is going to respiratory acidosis. Next step, compensation. That actually in that respiratory alkalosis, we need to calculate acute and chronic side. We need to divide it to the acute and chronic. If the patient having anxiety and panic attack, okay, so patient more hyperventilate, so more CO2 was wash out. So what happening? So carbon dioxide was coming down. Okay, so acute respiratory alkalosis, what happening in the situation whenever if you are doing that acute respiratory alkalosis, that bicarb was less than coming down 2 minutes, it's going PaCO2 was coming down for 10 value. You see here, renal was coming to the 2 minutes, PaCO2 coming to 10 point. Okay, now 45 minutes 35 like that. So PaCO2 was less and bicarb also here 28. PaCO2 was coming down, bicarb was 22. So the final answer is partially compensated respiratory acidosis with metabolic compensation. Okay, metabolic was compensating respiratory alkalosis. Okay, I hope is clear for you. Next to fourth example. A 65 years old male presented to the ER with fever, confusion and SOB for 2 days. His history of type 2 DM and hypertension. The patient reported reduced the urine output and generalized weakened. Family members mentioned that treated the antibiotic with recently for the urinary tract infection a week ago. Okay, this is a pH. pH was 7.1, severely decreased pH 7.19. So normal value how much? 7.35 to 7.45. Severely less. PaCO2 was how much? PaCO2 52. Bicarb was 16. Okay. Basics we can go on, we can fast and see. Okay, now first step was what? Check the pH level 7.18, severely less. So pH was less means acidosis. The primary disorder, next step we need to find the primary disorder, respiratory side or metabolic side we need to find out. Okay, coming to the acidosis means what formula? PaCO2 was climbing, bicarb was coming down, this is opposite direction. Okay, now PaCO2 was how much? 52 means this is a increasing trend. Okay, this is okay. Next, bicarb normally 22 to 24, but this is also coming down, this is also coming down, this is also correct, which means respiratory acidosis and metabolic acidosis, both condition is there, respiratory acidosis and metabolic acidosis. Okay, both system is involved. You see the clinic, this one, you see the patient history, patient is coming informing to the respiratory side, that's also, and this also, urine output, less urine output also, then SOP also, both system was involved. The final answer is respiratory and metabolic acidosis is the answer. Okay, no need to see the step number 3. Okay, compensation, because both system was involved here, so no need to compensating or no need to find out. So respiratory and metabolic acidosis. Now this is a very tough one that you need to little concentrate and see. Okay, example 5. A 72 years old man, history of COPD and heart failure, presented with lethargy and vomitings and SOB for 2 days. He recently started the furosemide for the peripheral edema. On examination, he is drowsy and respiratory was 10 by 5 minutes and saturation was 91 on room air. Chest auscultation reveals that scattered the wheezing and prolonged expiration. Okay, that pH was, that his ABG was showing 7.48 and PaCO2 was 58. Bicarb was 36. Okay. First step what I told, check the pH. Okay, we are checking. pH was 7.48. It will increasing. So alkalosis. If there's more than 7.45, alkalosis. I mentioned alkalosis. Alkalosis formula primary disorder. We need to respiratory side or metabolic side. We need to find out. Alkalosis not what I told. PaCO2. This is opposite side disorder. You see, PaCO2 are coming down. Bicarb was up. Okay. Now you put the patient value. PaCO2 value was how much? Patient value is 58. Okay, so coming down 35 to 45 is normal. Less than 35 is there? No, it's higher than is there. So this is not. So next thing, respiratory side, no respiratory problem. Okay, now we are coming to the metabolic side. You see the bicarb level now, it is climbing. Now you see the normal level 22 to 24. Okay, now it's 36. So metabolic side problem is there. So metabolic. So what I told here, alkalosis. Here metabolic alkalosis. Now we need to check the compensating or not. Here expected that PaCO2 what? How much expected PaCO2? That is formula. Okay, once you are applying that, it's coming the 40.2 to 50.2. Okay, actual in the ABG how much? 58. Okay, actually it's ranging here 58. Okay, patient ABG, but expected how much? That 40 to 50, but it's a 8 points extra is there, very higher is there. Okay, so which is called that PaCO2 was expected in the more than that, we can call it as a superimposed respiratory acidosis. You are thinking now, still now we are talking about metabolic alkalosis, but when you are expecting that more than that expected PCO2, it's going to the superimposed respiratory alkalosis. Two system was involved, mixed disorder. This is called two system involved and mixed disorder. Okay, it's very important. This is mixed disorder. Next, coming to that, this final answer is uncompensated metabolic alkalosis with respiratory acidosis. Why I am telling the respiratory acidosis, metabolic alkalosis, anyone if suing means you can tell. Why I am telling with respiratory acidosis, mean expected, you can see once you are applying the formula, it's more coming to the more than expected. Okay, the expected PaCO2 how much, 40 to 50, but actual PaCO2 is 58. Okay, I hope I clear.